Hello and welcome. I'm Andrew, the osteopath here at Thrive Body Clinic, and this is Coffee and Clinic, my regular sort of weekly podcast from inside the treatment room where I talk about blog topics for the week, roundup of patients I've seen, some UK health news that's relevant to you, and maybe a stretch, maybe a tip. So I have to make notes for what I've seen just to have something to remind me. So this week in clinic I have seen a very painful heel and calf following a pole dancing lesson. Their lesson, not my lesson, which was a first considering there's a pole dancing class at the other end of the corridor from my treatment room. I have seen lots of low back pain for a myriad of reasons. We've seen some very restricted hips, which are indirectly causing low back pain, and some knee pain. And another migraine patient looking for some relief, which was interesting because I actually don't see that many people with migraines, but I've had two, one after the other in the last couple of weeks. So that was interesting. It's always struggling for my words. It's always interesting meeting different people and different presentations of the same sort of thing. So yeah, I like it. It wasn't a low back, let's put it that way. And I think that was it. I think the rest was mostly low backs. So all the usual treatment approaches you would expect from an osteopath. A little bit of soft tissue massage, a little bit of articulation, and plenty of clicking as well. Although I know that's only it's not relevant to everybody. That's what I'm trying to say. Whatever the person needs is what they get. So onto blogs. I have been. I was busy over the weekend again. I don't particularly want to work at the weekends, having spent 5 years studying at the weekends and working during the week to become an osteopath. I did not then want to spend all my time working at the weekends, so I try not to. But I also like getting up early in the morning and doing something productive. So this weekend we were dog sitting a beautiful young puppy, and I was keeping him company in the kitchen a lot, mostly to make sure he didn't chew up the furniture. So whilst I was doing that, I filled my time by prepping all 3 blogs for this week. Today's blog, which I think I've already published by now, is about knee pain, basically how you can avoid needing surgery. So that's already published. So there's 3 tips which effectively come down to strengthening, mobility, and keeping them moving. Whether that's through lightweight exercise or no, that's entirely through lightweight exercise, walking, cycling, or swimming, for example. Wednesday's blog topic is rounding off the series I've been doing recently about explaining pain, and it talks about chronic pain and how we can work together to manage that. And then Friday is a coaching blog, and that is about the power of self-talk, which is kind of come from the mindset thing that I was talking about last week or a couple of weeks ago maybe, with the 2 patients that had the same sort of issue, but one came in literally telling me they were old, and the other one desperate to be told she could get back to what she wanted to do. So yeah, self-talk is it's so easy to talk yourself into something, whether that's talking worse to yourself than you would to anybody else, even people you absolutely hate, or just constantly telling yourself that one thing, like, oh, I'm old, whatever it might be. But with consistent practice, you can turn that around. You can catch yourself doing it, stop yourself doing it. Try and say something a bit nicer. But it's practice, 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 practice. So yeah, that's my 3 blogs for this week. I didn't dream of going any further than that to the week after, because I did actually want to do other things, but it was a productive bit of time. Excuse me. So health news. I didn't have very much time for, well, I said didn't have very much time, I had the usual amount of time. I spent my time writing blogs rather than looking at health news particularly. But the main thing from last week was the publication of the NHS Hospital League tables. Worthing, or the trust rather that Worthing's part of, did not come out particularly well on that front. But I think it was the first league tables for a couple of decades, maybe. And it ranks on a bunch of different metrics across the board, and that's not accurate for individuals' experience. I mean, for a start, you don't have a choice about where you're going to go. You're going to go to Worthing Hospital if you live in Worthing, because you're not going to suddenly go to A&E in central London unless you're nearby. But what was I saying? The numbers don't tell the whole story. For example, Worthing has an award-winning diabetes care, and yet it came out as 117th. Something about those two doesn't marry up. It's down to the nuance. So the rankings overall can help show where extra support is needed, but they don't pick up on the details. So long waits in one department might mean that the ranking goes down, but other areas are quietly ticking over. Excellent rehab, maybe fantastic maternity care. And the bigger picture, regardless of what media might want you to think, the bigger picture is we have got some of the best healthcare in the world, literally at our fingertips. It's still based on the original principles of compassion and clinical excellence. So I don't think we need to feel anxious about where our hospital sits on the league table. Just need to accept that it's the people that's there rather than the spreadsheets that bring up those results. That wouldn't be a good headline, which is why it's not the one that's being used. So, questions. I keep asking for questions or comments. I do need to check the comments. Somebody said to me that they couldn't put a comment below because it wasn't allowed, but I tested it and I could. So I don't know if that's because I'm just the person publishing it or not. So we'll look into that in more, well, I will check that after I publish this video. But if you can't put a comment below, feel free to message me, or you can email me at andrewtheosteo@thrivebodyclinic.com. But I had 2 questions, or a question and a comment, in fact, from the last week. The question was, did I apply for the NHS job? The answer is no. No, I didn't. I spent a long time working in a large bureaucratic organisation that had lots of good things about it, but I do not want to go back to a large bureaucratic organisation. I want to be my own business owner. I want to master of my ship, captain of my ship, captain of my own ship, if you will. I don't want to go back. I've taken lots of very, very good lessons from working in that large organisation, but no, I'm not swapping that for the NHS, which I imagine would be very similar. But as I said last time, still very, very encouraged that there are osteopaths in the NHS now, doing great things, getting lots of training, picking up all sorts of things, and just hopefully shifting the needle in terms of patient care and outcomes everywhere they are. So that's that. The comment? No, that was the question, wasn't it? So yeah, the comment was that the individual had never taken their blood pressure, which, depending on your age and general health is entirely possible. I think 40 upwards is when you should start, or when it's recommended that you start checking it. It's good to check, if nothing else, to just have like a baseline measurement, or establish if you have like a white coat syndrome where it goes up when you're in a clinical setting versus doing it at home, which I think I said last week is definitely a thing. If you can do it at home and get a more consistent reading, by all means do that. I definitely think you should do it if you're at a higher risk for whatever reason, age, weight, general health. But also, I mean, I'm quite geeky. I've worn a Fitbit for however many years now, and I do like looking at the data that shows how I've been sleeping, where my average heart rate's at, how it responds when I'm training. And then I know that's not essential. I don't think we've obviously lived without it beforehand, but it's like the blood pressure. It's a useful metric to look at, other than if you're losing weight, the focus is often on scale weight, which is not always as helpful as it could be, or your belt buckle, how your clothes fit. Sometimes they're not moving where you want them to, but if you were tracking your heart rate, you might be like, well, actually, I've lost a little bit of weight, but my average heart rate is in a much better place than it was previously. All the same if it's going in the opposite direction. Or you might see your sleep tracking isn't as good as you want it to be, and you're like, oh, what can I change? What can I change to improve that? And yes, you can just wake up and go, oh, I didn't sleep very well, or oh yes, I slept really well. But in terms of having a consistent measurement to track, it's just easy to have it. So that was a long answer for yes, I recommend you get your blood pressure taken at least once a year. So if you have any questions or any comments, you can either comment below or message me at andrewtheosteo@thrivepolyclinic.com. I look forward to every question or comment. Hello. This is taking a lot longer than I expected today because I keep running out of storage space on my phone that I'm recording on, and then I have to delete a bunch of stuff and try and shift stuff around. I don't know what to say about that. I'm guessing I'll get better with practice. I really hope so. So tips. I don't have a stretch per se today. So I'm just going to lean into the blog post I've already written for today about supporting your knees. So strong hips and thighs, gentle strengthening work. There's so much stuff on YouTube. Seated exercises for strengthening the legs. There's dozens of them. You just have to find somebody whose voice you quite like the sound of. And then consistent daily exercise will help that. I mean, if you're young enough and able enough, get into the gym. There's 80-year-olds in the gym here, so young enough was a ridiculous thing to say. I'm sorry, take that back. If you're able, go to a gym, go to a park, sit in a chair at home. Just make sure you're doing something to strengthen those knees and those hips. Then don't just rest. That's not going to it's going to help in the short term, but long term, that's not what you need to do. You need to be moving. So low impact exercises, walking as far as you can, try and build up the distance. Cycling, indoor cycle is just as good as going out on a bike. In fact, given the weather for the last couple of days, today is Monday, given the weather for the last few days, I definitely think an indoor bicycle is the way to go. And swimming is the gold standard of low impact full body exercise, so 100% recommend that. Even if all you can do is walk across the shallow end of the pool, the water will support your weight and give you a bit of resistance work at the same time. So all told, those two help you keep your knees happy, keep them supported, keep them moving. And then finally, third tip would be some stretching, a little bit of flexibility for the quads, the hamstrings, the calves, the hips. Again, plenty of stuff on YouTube for seated mobility work if that's where you're at. If you're able, there's lots of other options out there as well. Doesn't need to be much, 10 minutes. 10 minutes on a daily basis, 10 minutes on an every other daily basis. Basically, if you're not doing anything, starting to do something is the way to go. And I think I'll leave it there. Have a great week. I will be back with much the same next week. I can't remember if I said at the start, I was trying out a different layout today with probably more like a realistic clutter for clinic. I tuck stuff out of the way for patients, but not the blank canvas that I've tried for the last couple of podcasts. I'll be honest, I don't think I particularly like it, and I'm going to try going back to the blank canvas, switching up, maybe get the skeleton back in as well. But any comments, any questions, drop me a line, and I look forward to speaking to you next week. I really can't stand all this clutter. Just, where does it all come from? I don't know.